fortunate that I ran into you here at HRS. Do you mind introducing yourself?
Yeah, certainly. Theodore Takata, and we obviously know each other very, very well. I'm an electrophysiologist practicing in Fort Worth, Texas, in private practice there.
So you actually were one of those people in my first year of clinical practice who completely changed the way that I do clinic or I do my inpatient work because you brought up the concept of AI.
Right.
And it's not something that you're necessarily exposed to in training, but it
Mhm.
can really streamline your work efficiency. Can you tell me a little bit about that?
Sure. Well, I mean, it may not have been something that you were exposed to in practice because it's changing so rapidly. I mean, it wasn't around a year and a half, 2 years ago. So there's a couple things. So specifically, there are a number of products. I happen to be using Microsoft Nuance DAX Co-Pilot, which is basically an intelligent AI scribe. And what it does is it really has allowed me to focus on the patient. It captures using voice, my voice, the patient's voice, the nuances of the history taking, the symptoms that the patient is having. And then in addition to that, my explanation of what the treatment is. And so while it captures that wonderful detail, it saves me and my staff a tremendous amount of time in terms of the back end, really freeing me up to spend more time with my patients.
I think this is a perfect example of how AI can actually enhance our ability to take care of patients and to connect with them. And so technology isn't necessarily the enemy, right?
Correct. And I use the analogy of a car. Okay. I am not a mechanic. I can barely fix a car. I certainly can't build a car, but I also know where I want to go. And if the car can get me to where I want to go, that's the important thing. The car is not important. Okay. And AI is similar to that. I mean, it's the vehicle that gets me to where I want to go, what the results are. And again, the results are improving my patient encounters, improving my ability to spend time with them, to listen to them, and then hopefully explain, if I can, potential solutions to their problem, because ultimately that's what it's about. If I'm time hurried and I can't listen to them or I can't explain to them, then everyone suffers. And AI allowing me to do that really improves things. But I had this one positive comment that I don't think in 20 years I've ever received, which was the doctor was always on time. Because while that is important, because I was spending so much time with the patients and then having to go and write my notes, I was always running behind. And AI has allowed me to retain that time with the patients and their families and be efficient. And that's huge. And I have discovered some AI tools that has changed that, where I now am able to take those articles and those research and protocols and put them into an AI that not only digests it, but creates an audio file that I can listen to in 10, 15 minutes and gives me the gist of what I need to know.